the Bucks NAACP. Again, thank you so much for joining us in our education session of Learn More About COVID-19 Vaccine. This is organized by the New Americans Advisory Commission of Bucks County, Pennsylvania. I am also a member of that New American Advisory Commission. The specific purpose of the commission is to foster interracial, interethnic communication with new Americans, first or second generation, with the goal to identify opportunities throughout Bucks County for equitable economic growth and sharing of cultural experiences. One of the missions of the commission is to organize this series to educate the community about the COVID-19 vaccine, to clear your doubts and to answer questions related to the safety and efficacy of the COVID-19 vaccine. So I'd like to now turn this over to Bucks County Commissioner Diane Marsiglia to give her remarks.
Good evening, and thank you very much, Patrice. It's nice to meet you this way, and it's nice to be here with everybody. Wanted to give just a brief update on what's happening with the vaccines in Bucks County. To date, we have given 33,000 inoculations from the county health department. We are dividing those vaccines between 4 locations, and those 4 locations are the 3 community colleges, which is in Lower Bucks County on New Falls Road. It's in Newtown on the main campus, and it's in Percy, which is the Upper Bucks campus. And last week we opened in the Neshaminy Mall. It is in the old H&M store, which is in the Neshaminy Mall. We can handle about 700 people each at the 3 college locations, but we can handle 1,400 people a day at the Neshaminy Mall location. We'll be able to increase as we get more vaccines, but that's about the way we have it divided right now. I'm sure people have heard that the biggest problem, of course, is the quantity of the vaccines. The supply still remains fairly low. We are getting about 7,000 for the first shot every week, and then about 3,000 or so to start doing the second shot every week. So it's taking a while. If you are looking to get a shot, right now, I would suggest everybody wait until April 1st. It is possible to go on the county website and pre-register, but if you pre-register, all of our appointments are taken until April 1st. And on April 1st, we will open the website so that you can just schedule an appointment. You won't have to wait in line. You won't have to pre-register and then re-register. You'll just go in and pick your appointment. So I wait for April 1st, go on the buckscounty.org website, click on the vaccine and pick your date for your vaccine when you want to get that vaccine. The other thing that we can offer is we are providing rides. We have a contract with Bucks County Transit. So if anybody does need a ride, they can call the county health department, they can call my office, and we will make arrangements. The county is paying for these rides, so it's not a problem. Don't let that be a hesitancy. We will be opening up another vaccine site in Jamison, which is a nice big giant. Our health department itself, Dr. Dansker, will be delivering those shots. That will start in early April, probably the 2nd or 3rd. So that's a great one. If you live in the lower end of the county, that can seem far, that's a great time to call Bucks County Transit and get a ride for those. We are trying, or we were going to try to reach some harder reach populations with the Johnson & Johnson vaccine, because it's just one shot. It would be easier in certain populations, for example, homebound people. But unfortunately, the state has decided that they're going to only let themselves give out the Johnson & Johnson vaccination, and that's going to happen up in the Montgomery County Mall. So we're not going to be able to offer that right now. For anybody who does come for a vaccine, you will come right on time for your appointment. We have discouraged people from coming early. When people come early, lines form, and then we worry about social distancing, and then we're leaving people standing outside. So just come at the time of your appointment. No need to be there early. You will be asked for a form of ID, but you can actually bring nothing, and as long as you can identify yourself and you know your own birth date, that'll be fine. But you can bring a license, you could bring an electric bill, you could bring a pay stub, you could bring but a regular ID from work. It doesn't have to have a photo or anything on it. One of the things that we are also really trying to do is to reach out to populations that might not be as comfortable or familiar with Bucks County government. And some of those are some of the new Americans. So in order to do that, we recruited Dr. Farouk, and a couple other people, and we came up with a public service announcement. And that public service announcement encourages everyone to make sure that they're getting the vaccine. So I'm not sure if Dr. Farouk is ready, but maybe he can give us a showing of that. And I can stick around, so if there are questions, Dr. Farouk, you want to ask me anything, I'm happy to answer that too.
Yeah, thank you. So let me show the video that Bucks County has especially made for the community regarding vaccine.
And thank you for being a part of it, Doc.
There you go. So,
COVID-19 has killed hundreds of thousands of Americans and millions of people worldwide.
This virus has taken the lives of those we know and love and continue to affect almost every aspect of our lives,
especially communities of color. However, there is light at the end of the tunnel. The vaccine is here.
There are many people who have questions about the vaccine, and it's okay to ask questions. I had my own.
We know every vaccine has potential side effects.
We also know that these vaccines have been researched, tested, and
impact that COVID-19 is having on communities of color is particularly devastating, both physically and financially.
We are more likely to have frontline jobs that put us at risk for exposure.
We're more likely to live in multi-generational homes.
And we are less likely to have access to testing and quality health care.
These are the reasons I chose to get vaccinated.
These are the reasons I chose to get vaccinated.
These are the reasons I chose to get vaccinated and want other people of color to be vaccinated.
Being vaccinated will allow us to go to work without fear.
Being vaccinated will allow us to be together with our families without fear.
Being vaccinated will ease the disproportionate effects that COVID-19 has had on our communities.
अपने खानदान के लिए,
for your friends,
para sus compañeros de trabajo.
वैक्सीन लगाएं और जान बचाएं.
Vacunarse y salvarse una vida.
Get vaccinated and save a life.
Thank you.
yeah, thank you so much. Thank you, Diane, for making such a beautiful video for COVID-19 awareness. And thank you so much for joining us. And thank you for your great work for vaccines. So now it is available right here in Bensalem in the Chamonix Mall. And
That's right.
yeah, thank you again, and thank you, Beatrice, for joining us tonight and introducing Commissioner and introducing our commission. And thank you so much. And thank you everyone for joining us tonight, as taking time from your busy schedule. And thank you, Anthony Torr. So you are leader of Liberian community, and we also have here Liberian Radio and Television Network, and this is going live right now. And if you don't get opportunity to watch it now, so you can watch it on Facebook and YouTube and later on at your convenience. So this will be available. And I really thank you, Liberian Radio and Television Network, for doing this for the community. This is a community work, especially at this time we are in the pandemic. Thank you. So, as you know, the COVID-19 pandemic is still global health crisis. To this day, we have worldwide 124 million cases. In USA, 29.9, almost 1/4 of the cases in United States. And in Pennsylvania, almost close to like 10,000. Sorry, 994,000, sorry, my math. And in Bucks County, 48,000. So, a number is still on rise. And finally, we have light at the end of the tunnel, and we have COVID-19 vaccine here. So, there are common questions that I'll be addressing tonight. And you may ask me question at the end of my presentation, and you can give comment. And these questions are genuine. So first of all, this presentation is for African communities, and we are not proud of what happened in the past about syphilis vaccine. And there's a concept of being used as a guinea pig. So you might have a lot of doubt and question, and you're more than happy to ask me. And at the end of my presentation, the common questions are, what is COVID-19 vaccine? What is an mRNA vaccine? Is it dangerous? How does it work? How did we get this vaccine so quickly? How do we know vaccine is effective and safe? What are the expected side effects? Where can I get accurate information? Why should we trust a vaccine? This is a very common question. What if I have to have had COVID-19? Will I still need to wear mask? So these are the common questions that I will be asking. If I miss anyone, you can ask me after my presentation. So what is COVID-19 vaccine? So most traditional vaccine, they use inactive or active part of the virus, like flu vaccine, MMR vaccine. So this COVID vaccine, it does not contain any part of the COVID-19 virus. This COVID vaccine is an mRNA vaccine. mRNA vaccine technology is not a new idea. It may be new for this only for this vaccine, but it has been used in research for cancer treatment of almost over 10 years, especially for the treatment of melanoma. How does the vaccine work? So the COVID-19 mRNA vaccine give instruction to our cells to make harmless pieces of protein that look like the same spike protein that we find on the surface of the virus. Our body recognizes these harmless proteins and build antibodies to remember how to fight against these spike proteins. When someone is infected with the COVID-19 virus, these antibodies will recognize those spike proteins of the virus and fight against the virus. So basically, it will kill the virus. Can mRNA vaccine change my DNA? No. mRNA vaccine does not affect your DNA. It is very short-lived, and it will not incorporate in your DNA. It's only use the machinery of the cell to make antibodies, and actually there is no nanorobot in it. Can mRNA vaccine give me COVID-19? No, it does not. It actually protects you for COVID-19. So there are two vaccines. They were first introduced, Pfizer and Mrna. Pfizer, two dosage, 3 weeks apart, age 16 and older. Mrna, 2 dosage, 4 weeks apart, 18 years old and 18 and older. These both vaccines are mRNA vaccine. So about the effectiveness of this vaccine, the studies were done on diverse population. Over 40,000 people for Pfizer and over 25,000 people for Mrna. Pfizer 95%, it gives you protection, 95%, and Mrna is 94.1. Statistically, there is no difference between these two vaccinations regarding their effectiveness. How long will it last? Protection starts 1 to 2 weeks after you get vaccination. Initial studies have shown that antibodies may be present in the blood for 3 months. Long-term immunity is still being studied. Hope that antibodies will last for months and years. Will I need to get this vaccine every year? So this need for annual vaccine booster, it is still unknown. It is still being studied. We'll follow this one, how long the antibodies stays in the body, and the studies are going on. So concern about COVID-19 virus variants. You know, there are COVID-19 variants. They are found in this country and also in the world. So this vaccine is effective against those variants. So studies have shown that one. And although it's being closely investigated at this point, but it will be effective against those variants. So the third vaccine, the Johnson & Johnson, this is a vaccine you need only 1 dose. So this is also, it's worked like this mRNA vaccine, other vaccines, but it uses a common cold virus, part of the common cold virus. So, but actually it does the same thing. It gives instruction to your cell to make antibodies the way the other vaccine does. And these antibodies will fight with the virus when virus attacks our body. Johnson & Johnson was studied on 45,000 people in 8 countries, and about 20,000 people were from United States. So this vaccine is effective 72% and in USA for moderate to severe disease, and 85% in preventing severe disease, and also give you complete protection against COVID-19 related hospitalization and deaths. And this was authorized last month. and it is only one dose age 18 and older. Are the COVID-19 vaccines safe? The most important priority in vaccine approval is safety, and no step were skipped. The FDA typically requires 3,000 participants are included in the trial. The current vaccine trial included, as I said before, 25,000 for Mrna and 40,000 for Pfizer. So most of the side effect of the vaccine, they start within 6 weeks. So FDA required 8 weeks of safety data for COVID-19 vaccine, and we did not see any major side effects in 8 weeks. And also there are 2 independent advisory committees. They review all this data, and that was reviewed by the FDA. So these advisory committees have no relation or conflict of interest with any vaccine company. So monitoring of the safety will continue as the vaccine are more accessible and distributed to the public, but they're still, we don't know, and but it will be monitored. What does emergency use authorization mean? We have heard this word a lot, EUA. So emergency use authorization is based on the need of the vaccine to be used quickly to save lives during public health emergency. And COVID-19 is public health emergency, and this opportunity was availed. So this is other common question: how was the vaccine made so quickly? This was because of there was a global effort of the world leading scientists and researchers. They only focused on one task, that was COVID-19 vaccine, and nearly unlimited resources were provided by the United States, $10 billion, and there were large pool of diverse volunteers participant in the trial, and previous experience with the mRNA technology also helped. Should you get vaccinated? Yes. Why? Protect yourself and your family. Help reduce spread in the community. Set an example for others, families, friends, co-workers, and community at large. You must get the second dose, and the vaccine will not be fully effective until you get the second dose. And it is important, that's why it is important you have to get the second dose, you get the full effect of the vaccine. So what should you expect after getting the vaccine? So there are side effects. There's always side effects. There's short-term discomfort you can have. You can have fatigue, pain at the injection site, muscle pain, headache, low-grade fever, and chills. It happens with other vaccines like flu vaccine, but the symptoms last 24 to 48 hours, and they're more pronounced with the second dose, especially of Mrna. So you may get high-grade fever to 102. One of my office staff has 102 fever. So, but effects are expected and they're normal, and that means our machinery in the body is working against the virus and making antibodies. So, will you still need to wear a mask? Yes, until large number of people in the community are vaccinated before we stop our masks. Even we are vaccinated, we can spread the virus, because the virus still can stay in our nose and can spread to other. It might not be making us sick, but it can make other people sick. So that's why it is important. So to get everybody to get vaccinated and wear mask until most of us are vaccinated. And the good thing, this year we did not see any flu cases because we were wearing masks. So I have so many flu vaccine dosage in my office, but I have given, but not that many this year because people were not willing to get, because there is no flu around. And I think the mask has a great role in preventing vaccine this year. So what if you have already COVID-19? Yes. It is safe to get vaccine if you already have COVID-19, and it is important to still get vaccinated to provide protection. So if you have a COVID, you can have protection in your bodies for 3 months. The antibodies were present at 3 months. So you can get vaccine 2 weeks after the recovery of the COVID-19. The purpose of this 3-month wait is because the vaccine is, we don't have enough vaccine, and there are a lot of other people, they need vaccine, and they have no COVID-19 infection in the past, and they're at high risk. So immunocompromised patient, the patient who has cancer, then receiving chemotherapy, the efficacy of vaccine is not yet established because those people were not included in the study. And regarding pregnancy, there's a limited data available on safety. Actually, there are studies are going on and on the pregnant woman, and they found antibodies in the umbilical cord blood and also in the breast milk. So there might be antibodies, these antibodies may be giving protection to the fetus. So that is a positive thing, but still these studies are preliminary, and we don't know the long-term effects. This is very important to understand this slide, Pennsylvania vaccine plan. So phase 1A, so initially the phase 1A was healthcare personnel, long-term care facility residents, and clinical personnel in school setting or correctional facilities, age 65 and older. This was initially when we started this vaccine, but afterward we added age 16 to 64 with high risk condition, and those conditions: cancer, chronic kidney disease, patient has kidney failure, COPD, that is a lung disease, Down syndrome, heart condition like heart failure, obesity, and pregnancy, sickle cell disease, and smoking. How many people smoke here? A lot. And type 2 diabetes. So this is very important to understand. Age 65 is important, but we have to look into other things. So these are the phase 1B and 1C and phase 2. 1B, the first responder and food and agriculture workers and childcare workers, and phase 2 is essential worker in various sectors, and phase 2 is for general public. But just remember, if you go back in phase 1A, a lot of people from phase 1B, C, and even phase 2, they fall in phase 1A because they have diabetes, they are obese, they are smoker, they have lung conditions. So many people fall in, almost I'd say a lot of people, I say more than 50% of people fall in this phase 1A. So make sure, like, if you have any of these conditions, so you can get it and you will not be denied. Actually, no one will be denied. So where can I get the vaccine? So I found this vaccinefinder.org. You can go on this website and put your zip code, and you can find closest location and you can register yourself. So I found this was very helpful. And there's another site, solvehealth.com. You can go on this website and put your zip code, and you can find closest location in your area. So Bucks County website, as Commissioner Marseglia said, there Neshaminy Mall, and there I think the community college, and in April it's going to be very easy to get, so without registration, as Commissioner Marseglia said. But you can go to this Bucks County website at this time, and I have given instruction how to register yourself. You can take a picture of this slide if you want to, and also you can call 1-800 number, that is the help desk, and you can register. So this is a easy process. If you look into that, you have to go to buckscounty.org and click to Bucks County coronavirus vaccine information, and then scroll down to pre-registration link, and you can get registered. So this is a lot of people ask me about this, how to get registered. So this is an easy way to register. So as Commissioner Dan Marseglia already mentioned, what kind of ID card need, because this is really a problem, because a lot of people, they are not comfortable going to the pharmacy and other places for their ID, and a lot of people, they have some other issues there, like status, so visa status here. So you can have any of these ID things. So you can have photo ID, you can have work ID, You can have your pay stub, your utility bill, birth certificate. So actually, if you can verbally, you have ability to confirm your name and address and date of birth, you don't need anything. Just you can tell them who you are, your date of birth and your address, so you can get it. They should not ask you any other thing if you have this information. You can have your insurance card and the school ID and parole paperwork if somebody. So, and there is no charge. This is, you don't have to pay anything for this vaccination. This is free. So I got COVID-19 vaccine. I'm still wearing mask. So not right now I'm presenting, but I do when I'm with the people and in hospital, in the community. Mask up. So do your part, get vaccinated and wear a mask to help others. So this is the end of my presentation. So if you have any question, you can ask me. And we may have questions from Liberian Radio Television Network. So I will answer that if anybody has any. Thank you for joining. So, any question? Sound like everybody is okay. Let me into chat. Anybody have anything in the chat? Is it? Yeah, there's not. So, any question from Liberian Radio Television Network?
I do have one.
Okay, so we have one question from.
So you spoke on the Johnson & Johnson vaccine. It protects against COVID, and what was the other thing that it protects against?
It's protect you, full protection against hospitalization and especially the death, so from COVID-19.
Okay.
Yes.
Now, how does, besides it being one shot, how does that vaccine differ from the other two, Pfizer and Moderna?
The technology is a little bit different in those, but this one they made for one and the other one is two, but this is all the technology they used. So, yeah.
Now, the vaccines that are coming out, they're going to protect against the new variants as well, correct?
Yes.
Okay.
They will protect. The study suggests that they will protect you against these new variants because the variants are just a little bit minor change in the spike proteins. They might be the same, so it's still it will protect against variants. Yeah.
Hi, good evening. This is Anila. I work for Dr. Umar Farooq. There is a question in the chat. When can we get vaccine from your office?
Oh yeah. So actually, we applied about a few weeks ago, and we were approved, and we are requesting every week on Friday. We had to put order in, so we are doing it, but still because the supply is not enough, so we can get anytime, but we don't know when they're going to give us. But we are applying every week to get vaccination because office is approved, and as soon as I will put on my Facebook and everybody will know it, and I will tell my patients.
Thanks, Dr. Farouk. I saw Alexine. Is that how you pronounce your name?
I wanted to ask a question. I have COVID, and he was in the house for, I think, 10 days. And then when he was done, I asked him to go back to the doctor and get tested to make sure he's fair. And I was told that you don't have to do that. So once you serve your 10 days, you automatically get healed. But he still had, he still didn't have his case and spell that.
So your question was?
My question is, once you serve your 10 days, are you completely cured? Can you pass it on to somebody else?
After 10 days, after COVID infection, actually if you have no fever, no symptom for 48 to 72 hours if you have infection. So after 10 days, 10 days important. But then if you have no symptom for 48 to 72 hours, then you are almost infectious free. You will not spread it. But if you, and even on the 10th day, if you are running fever, you are coughing, so that means you still have active disease. So 10 days, 10 days basically like somebody get exposed, somebody had it. So 10 days is the minimum that we recommend. So if they have, the symptoms are gone, so they are okay. So sometimes you might have minor symptoms, but later on, because this is a viral infection, so you may have a little bit cough for a longer period of time. But after 10 days, you will, not be infected to other people. Yes, we have librarian TV.
Dr. Farouk, so
yes.
If I had the COVID-19 vaccine, if I had COVID and then I'm fine, I'm better, do I still have to get the vaccine later on, or now that I have immunity, am I fine, or will I still be able to spread it?
So if you have COVID-19 infection, you still need to get COVID-19 vaccination, because these antibodies with the COVID-19 infection you have that might not last that long. But we know that they last for 3 months, but after that we don't know. But getting vaccine, you can get a better protection against COVID-19, even you have COVID-19 infection. But you can wait up to 3 months because your body has the protection for 3 months. And you can get 2 weeks after your recovery. Suppose you are like 2 weeks quarantine, and so you are recovered. Then 2 weeks after recovery, you can get it. Most experts say that. Yes, you're welcome.
Another question from the Liberian Radio and Television Network. The question I have is it possible if you can reiterate how immigrants or people with no status will be able to get their vaccine?
I think one of the things I told, if they can go and tell them what's their name, what's their date of birth, what their address, that is one of the criteria to, if you don't have any ID, but you have to verify, just tell them what's your name, what's your address, what is your date of birth. So they, I don't see any reason that they will not get it. Yes, they don't have to have their ID, photo ID. Yes.
Dr. Farouk, there is
Yes.
another question. If someone has leukopenia, would they be okay to receive the vaccine?
Okay, so this is a very, very good question, because these people are like immunocompromised, and they did not include these immunocompromised people in this study. But if you go on the other hand, they are high risk for having infection too. So they can talk to their oncologist. But I have spoken to them. So one of my patients, they said, yeah, you can give it, but it patient to patient, and actually they need more protection. If you're immunocompromised, you need more protection. So I think the white cell count, this is work differently. It makes like those proteins, spike proteins and antibodies like they're going to fight against the virus. Although they have low white cell count, they're high risk for having any infection. But they were not included in the study. So
Another question, are they planning to vaccinate our children anytime soon?
yeah, I just have this, there's the studies are going on, and I don't know when they're going to be completed, but they are doing study on children and as well as pregnant women. So their preliminary report, as I said, about pregnancy and when they delivered the baby, as I said, and they saw antibodies in spinal cord blood. So these studies are children and pregnant women, they are in progress. But at this point, we don't recommend children less than 16. Yes.
I have one more question. Will the vaccine become mandatory anytime?
Hey, Commissioner Diane Marsaglia might give a better answer to this. Diane? Let me see, Diane might have, okay, Diane might have been gone. So, I don't think so, but one thing I can tell everyone, like when you get your vaccination, they give you a card. So keep that card with you. Make picture of that one. So in future, I don't know, but I can guess if they make it mandatory if you want to travel. So you have vaccine, so you have your card, so you can show the card. Oh, this is my card. I got my vaccine. So these things are these logistics still we don't know yet, because right now we're in pandemic. Our goal is to give more vaccination and protect community. But I think I will keep my card with me.
I would interject a little bit there, Dr. Farouk.
Yeah, sure.
From an employment standpoint, I don't know in general if it can be, made mandatory, but for some people, your employer can make it mandatory for you because they do have do have the leeway to do so under federal acts. So employment-wise, yes, it can be made mandatory generally. As Dr. Farouk said, that's something, the commissioners may have to look at, or federal government, will have the say on that. But individually, that's where it can affect individuals in their employment stance.
Yeah, you are right, Patrice, because flu vaccine, certain hospital, they make it mandatory. When I go to Jefferson, every year they ask me, they need a proof of my flu vaccine. So you're right, the employer may make it, they can make it mandatory. Thank you for answering this, Beatrice. You have a Librarian TV?
I have two questions. One, is there a triage to who gets the vaccine first? And then my second question is, how long after getting the vaccine am I able to go back into the public?
Okay. So first question, the triage. So I think I mentioned those phase 1A. So phase 1A, that age 16 to 64, and if they have any kind of medical condition like diabetes, heart problem, they're obese, they're smoker, they have lung condition, so they qualify. So a lot of people that's younger, they're not 65, they're younger, but they still qualify in phase 1A. That's currently we are in phase 1A. So I think so many people qualify for phase 1A, given like obesity, it's very common, so a lot of people. So diabetic, so many younger patients, they're diabetic. So this you can look into phase 1A, so that give you that eligibility. But I think when you go there for the vaccination, they most of the time they're not going to ask you too much, because if you say that you're obese, okay, they do it. If you say that you're a smoker, they will listen and they will do. So be honest.
And then my second question is, how long after getting the vaccine can I go back into the public?
Even there's vaccine has nothing to do go into the public. You can go into the public even without getting vaccine. You have to have your mask on.
Don't have to quarantine though.
So we're talking about somebody has COVID-19 infection.
No, I'm saying do I have to quarantine myself basically after getting the vaccine?
No, okay. So COVID-19 vaccine, as I said in the beginning, COVID-19 vaccine is not a virus. It don't give you COVID-19 disease, so you don't need any kind of quarantine after getting your vaccine, because this is a harmless. It's just making antibodies that can fight against that COVID-19. It's not a part of COVID-19 virus, and it will not give you COVID-19 disease, so you don't have to quarantine yourself. It's just a regular mask after vaccine.
Okay,
Yes.
you.
Another question from the Liberian Radio and Television Network. One of our viewers would like to know, you spoke that Mrna and Pfizer vaccine is in that 95 percentile range of being effective. How effective is the Johnson & Johnson?
Johnson & Johnson is like, as I said, it's like 78%. 78% preventing moderate to severe disease. And but it has a full protection for hospitalization and death. Fully protected, that was in the study. So that is very important. The people, you might get COVID-19 infection even you have vaccination, but it's going to be very mild. You might have a little cough, cold, so you might not even know much, so you might have a little bit fever. So it's going to be mild infection. So that's Pfizer has given the full protection for hospitalization. That means that if people got sick, they have COVID, they have very mild COVID, they did not need hospitalization, and there was no death. So yeah.
Okay, Dr. Farouk. I'm going to speak in our local language, okay, our regular colloquial. Uh, so everybody that watching, I want to ask the doctor about some people who went to work from the Liberian community and they took the vaccine and they got sick. They came back home, they said they got cold, they got sick, and they couldn't get up, they couldn't do nothing. So I know everybody's watching, but I know you want Dr. Faru to tell you if that's going to cause any problem. Do you get scared to take the vaccine? Or is it going to harm you? If you take it, you're going to get sick. So Dr. Faru, begging you, please tell the people.
Yeah, but when you get vaccine, minor side effects you can have always. Like you get flu vaccine, you can have minor effects like fever, little bit fever. You might have muscle pain, fatigue. But with this one, especially with Mrna, with the second dose, you may have high-grade fever. You might be feeling very weak and tired. This only lasts for 24 hours. And these side effects mean your body is working and against this, making antibodies and ready to fight against virus. So, and these symptoms gonna last for 24 to 48 hours, not more than that. So that is, you see more with Mrna as compared to Pfizer, and that this kind of side effect with the second dose. First dose, you don't get that much side effect, but the second is like, just remember, you might have 102 fever, so don't get panic. Just take Tylenol, just regular pain medications.
Okay, Dr. Farouk, we want to hear from you. Most of our people out there watching. Did you take this vaccine?
I took my vaccine. I'm proud of getting vaccine. I got Pfizer and I got my vaccine. And after the first one, I didn't feel much, little bit like feverish. And after the second one, the same thing. I was a little bit like tired at that night, only one night. So, and I have pain at the site of injection. That was my main symptom, the pain that kept me awake at night. And I took Tylenol. So I feel so good. I feel great. I don't see any nanorobots in my blood. I can see. So it's a pretty safe. It's with my personal experience.
Okay, so if you old African person, and you're in the community, do you be scared to go take the vaccine? If you're old, it doesn't matter. You can go take it, or when you're young.
The older people, they are gonna get they're because they have medical condition and they get COVID-19, and it is really, they get really sick. So older people, that's why age 65 initially we started, age 65 and above. But people, they got very sick with the COVID-19. I have said, like, people died with it. Younger patient in their 30s. So this vaccine, it's for everyone, young and old. And the one thing is, like, younger people, they can bring home like infection when they go out, and they can give to their parents and grandparents. So that's why that's important to everybody to get vaccinated.
One last question.
One last question.
If you are going to events with large populations and you've been in these events, do you think that you should you should want to take the vaccine? Do you think it's the word I'm looking for? Do you think that it's forced for you to take the vaccine if you're being out amongst populations of large groups of crowds?
I think, like, regardless of small group or large group, everybody should get vaccinated. That is important. Suppose everybody in this room is vaccinated, so we don't have to wear mask if all of us are vaccinated here. But if one person or 2% they are not vaccinated, so then of course we have to have mask. So in larger population, if you're vaccinated, you are protected yourself. If you go in a larger, but you still have to have mask. So with the vaccine, you are protected 94%, 95%. So that's but the other people, they can get infection. Even you have COVID-19, you can still carry on those virus, and you can spread to other people. So that's why the masks are still important, small gathering, large gathering, until most of the people get vaccinated.
Okay, one last question.
Okay.
How long do you think until we'll go back to normal? Until we don't have to wear masks, or until everyone's vaccinated?
Yeah, I can request. Rehan, can you
In
get my
your
magic wand? This is like the goal is like at the end of the May or June, lot of population to get vaccinated. So if everybody get vaccinated, like so in July, August, and September, so we're gonna see a lot of normal life during Christmas time. So I'm hoping over Christmas we can celebrate the way we used to celebrate this year. That's what I think.
Okay,
We
Dr.
have a
Farouk.
question. Oh, sorry. Go ahead.
Go ahead.
Okay, one question from Zoom.
There's a question in the chat.
Okay.
It says, if one is on blood thinners like aspirin, is it okay to continue to take it even after taking the vaccine?
Yes, yeah, you can take it. But the only thing is if you are taking blood thinner, when they give you injection, you can bleed a little bit more at the injection site. But otherwise, there's no contraindication if you are taking blood. Just make sure if you are on blood thinner, you put the bandage on where you get the injection so you don't bleed. But yeah, there's no contraindication with aspirin. Even Coumadin, that is another blood thinner people take for blood clots. Yeah. So, any other questions?
So
There's one more question from.
no more question. All we want to say, thank you very much for using the Lrtn, and it's important that we come here because you service majority of the African Liberian community. So it's an honor to be here with you, and we hope that people will continue to follow you and use your office. And we know that this is a wonderful place. We're open always. We come here, we well respected and taken care of, and we hope that we can work together to make our community a better place.
Thank you, Lrtn. I really love Liberian community, Nigerian community, all the African communities. I have some natural kind of love with all of you. I can tell you right now, and you can feel it. So, thank you so much for joining and everyone, and I'm looking forward that everybody will get vaccinated. Anybody has any question, you can call me. You can talk to me directly. And thank you so much, everyone. And thank you for joining, and good night.
Thank you, Doctor.
Good night.
Thank you, Dr. Farouk.
Thank you, Dr. Farouk.
Thank you, everyone.
Really, I like
Thank
it.
you. Thank you, Dr. Farouk.
Thank you, everyone.